It's horrible to encounter cold, heartless evil, dark, bleak, and depressing. And reading the report of the Scottish Government's expert advisory group on abortion, it was an encounter with that type of evil. You're reading people with an utterly callous disregard for the value of life. To be honest, I felt a bit sick reading it, page after page from the website of our Scottish Government. But you really need to know what's in this. It'll be in a bill in the Parliament sometime in the next year. You might have heard snippets in the media from campaigning groups, but I want to go through systematically looking at the main points, and it's extremely concerning. Obviously, there are 1,000,001 more entertaining things to watch on YouTube or whatever you're watching on. You could flip over to, but I would urge you to take the time to watch this through because it is of critical importance. Right, this group starts off its report by saying the Scottish Government established the group with the remit to provide recommendations to ensure that abortion services are first and foremost a healthcare matter. The Scottish ministers made clear their wish to ensure that patients in Scotland can continue to access abortions. In other words, this is a one-way street. They've already decided abortion is healthcare. In other words, it's not a moral issue. We're not talking about the value of human life here. We're just talking about healthcare. So the decision and the direction are set before they even start with their deliberations. And the report says the views of many organisations which campaigned for restrictions to abortion in the UK were sought. And you can see that in the report. They've got quotations from the usual pro-life campaigning groups in Scotland. Okay, it's good that they made these contributions. But I say ultimately, though, they were wasting their time. They're sort of being duped. They're being strung along. They're being given the impression that they're playing a part in the process, when actually it was already decided before the process started that they were going to be entirely ignored. So they've been trying to engage in this sort of diplomatic negotiation sort of approach, and it's been a total failure. It's not their fault. It's not that they didn't lobby very well, not that they didn't put their points over very persuasively. It's just they're trying to engage with a group that is totally ideologically opposed to them. So the outcome, the fact they've been completely ignored, is entirely inevitable. Right, so what's the report recommending? It says no specified grounds should be required to access abortion care, you get these euphemisms all the way through, up to 24 weeks gestation. So that would be a change from the current system where you need the signature of 2 doctors. So would this make much difference? Well, basically no, because the current system is that 2 doctors lie on the forms, and it's very easy to get 2 doctors to lie on the forms saying that this is necessary for mental health reasons or whatever, even though there are no demonstrable mental health benefits from abortion. So what difference would this change make? Basically, it would make virtually no difference in practice. But more importantly, what happens after the 24 weeks limit? Currently, abortion is only allowed for disability or save the life of mother, etc. But they want to change that and make the system that after 24 weeks, abortion can take place where 2 healthcare professionals decide in good faith that performing an abortion is appropriate. On what grounds do they decide? Well, the gestational age of the fetus, all relevant current and reasonably foreseeable medical circumstances of the patient and the fetus, the patient's current and reasonably foreseeable physical, psychological and social circumstances. Right, that is more broad and more vague than the current grounds for an abortion before 24 weeks. So what they're doing, they're making it so that getting an abortion after 24 weeks would be easier than it is currently to get an abortion before 24 weeks. Okay? So effectively, they're abolishing the time limit. Now, people are already arguing back, saying, no, they're not abolishing the time limit. They're not abolishing the time limit. But they're making it so that, say, getting an abortion after the 24 weeks will be easier than it currently is before 24 weeks. So if the only change that was to happen, if they just said, okay, we're removing the time limit, that will create a system that will be more restrictive than what they're recommending. Okay? They're making it more liberal before 24 weeks, and they're making it a lot more liberal after 24 weeks. Okay, so it effectively is abolishing the time limit. That is, in effect, what it would be doing. Abortion up to birth on the NHS. It says there's no no specific reference is to be made to sex-selective abortion within any updated abortion legislation. And it explains why. And the reason is they think these are culturally sensitive issues, and they're worried that people of some cultures and backgrounds might feel that there's suspicion on them in these cases. Now, I think that's the wrong reason to be looking at this. I think it absolutely should be a crime, sex-selective abortion. But to me, it's a very marginal issue. The issue is abortion. Whether there's sex-selective abortion going on as well, that's a really tiny, tiny element of the big picture. But their recommendation, I think, is wrong. Sex-selective abortion should be particularly illegal, but abortion shouldn't be happening, full stop. Right? They say that mandatory counselling should not be included in abortion legislation. Right? Well, it should be, because any woman considering abortion should discuss at length the emotional, psychological consequences that are likely from that, and they also need to be made fully aware of the options, support that would be available if they went through with a pregnancy and became the mother of that child, and also the possibility of adoption. There are couples queuing up to adopt newborn babies, and everyone coming for an abortion should be made aware of that. So the guidance, their advice, I completely disagree. Right, next thing says the Abortion Act states that no person shall be under any duty, whether by contract or any statutory or other legal requirement, to participate in any treatment authorised by this Act to which he has a conscientious objection. The group recommend that by contract be removed. In other words, that they remove part of the conscientious objection right. And the direction they're going in, basically, is towards saying, well, if you don't want to do abortions, then don't get into this field of medicine. Don't be an obstetrician. Don't be a gynecologist. Don't be a midwife. Because if you don't want to do abortions, then just don't enter this field at all. Don't train in this area. Don't apply to register. Don't get a job in this area. So that is the line they're going down, which is very sad indeed. So we've got someone who's saying, I would like to devote my life and my medical training to facilitating bringing new life into the world. And they would like to say, well, you can only do that if you're happy to be involved in killing unborn children. That's what they are recommending. Right, the next thing, adults with incapacity. The Mental Welfare Commission should ensure there are clearer pathways and guidance in future for helping ensure swift processes and support for adults with incapacity where an abortion is being considered. Right, being considered by who? Obviously not the adult with incapacity. So to give an illustration of the type of situation this could be applied to, let's say a woman 8 months pregnant, and let's say is involved in a car accident and is critically injured and total loss of normal capacity. Then I think this is the sort of situation where they'd say, okay, so the medics on the spot can make a decision to perform an abortion. So instead of delivering the child, which might have been possible, they could instead decide an abortion, and this process needs to be swift. That's what they're saying. They want there to be no obstacles in the path in these types of situations. Next one. There should be no offences for anyone ending their own pregnancy, and any common law offences should be repealed. Right, this is basically decriminalisation for the woman. This is exactly what's happened in England and Wales. So if a woman ends her pregnancy by whatever means, at whatever stage of gestation, then she's not committing a crime. So, for example, if someone lies in the telly interview to get pills by post, takes them knowing full well to way beyond the limit recommended, I mean, then it's not a crime. That's absolutely fine. So that would happen increasingly. Right, the next one. The Concealment of Birth Scotland Act 1809 should be repealed, and the crime of concealment should be repealed. Now, I'm not at all sure about this. The idea of this concealment crime is if a woman is having a baby and she has the baby without seeking any help, just on her own, not because she's far away from any help, but she chooses to just have the baby on her own, and then the baby is dead. Okay, and the woman's claiming the baby died, but there's suspicion might be there. Well, actually, this woman didn't want the baby, so she didn't want anyone else there, so she's let the baby die or kill the baby. So that's what the Concealment of Birth Act is trying to prevent. Women basically having babies in secret, in private, and then letting them die and claiming that they died on their own. But the report says we need to scrap that, which I would imagine would lead to cases of infanticide. Maybe very rare, but I think it could happen. All right, next one. The common law offences for registered healthcare professionals who provide an abortion out with the terms of abortion legislation should be repealed. So in other words, a medical practitioner performs an abortion without following the proper procedure. I would say, it's virtually impossible to see how that would happen, because this is basically going to be abortion on demand up to birth. So I can't see why any healthcare practitioner would be doing that. But the report says if someone did manage to perform an abortion that wasn't following the regulations, maybe it could be just dealt with as professional malpractice. I say I can't see how the situation could arise though, because what's proposed is so liberal that there's virtually no way of breaking the law or no reason to break the guidelines, whatever. Right, next thing, any new offence should be carefully considered so as to avoid prosecuting anyone helping someone to access an abortion in good faith, such as a mother helping her daughter. Right, I think, what does that mean? Does that mean that mother procures abortion pills one way or another to give to her daughter, for her daughter to take them outside the guidelines? It seems like a pretty broad protection there. It sounds like if a person is helping a woman to get an abortion that is not following the guidelines, it's not illegal because nothing's illegal. A woman cannot break the law in having an abortion. So it seems to be saying if anyone helps a woman having an abortion, well, really we've got to protect that as well. Very, very dangerous. Right, this next bit shows the state we're in. All the relevant professional health bodies in the UK support decriminalisation of abortion. How about that then? I won't read them all out. How many? 1, 2, let's look at that lot. Look at that. All of them calling for decriminalisation of abortion. That's like the medical establishment firmly of the position that the unborn child has no moral worth. That's tragic, isn't it? Right, the next one. This is the Scottish Government report, so we're used to coming across passages like this. This gives an illustration to support their conclusions. A case study. A 16-year-old girl who found out she was pregnant at 23 weeks. Her family were anti-abortion, so she had to ask her boyfriend's mother to take her to London for treatment at a BPAS clinic. She says that the fear and shame she suffered at the time made her contemplate suicide to escape the situation. I'm just so fed up of reading this sort of thing from the Scottish Government. The message is basically, you've really got to pity these poor kids who are born with, Christian parents, pro-life parents. What a nightmare for them. We really need to protect children from parents like this. Maybe in 30 years' time, when that girl's living with the effects of the abortion, then maybe she'll think differently. But the Scottish Government and their agencies and representatives are quite happy to regurgitate demonisation, basically, of Christian parents, and to explain how the state needs to intervene to protect poor old kids from Christian parents. I know this is not the government speaking, but this will be the sort of thing that the government will take up to justify their changes. Right, next bit. The group also carefully considered the available evidence regarding the likelihood of perception of pain before 28 weeks gestation, noting significant disagreement in the scientific literature. Right, if there's significant disagreement about whether or not you're causing unbelievable agony to an unborn child, then I think you err on the side of caution, to say the least. But they're presenting this as a reason that, no, we shouldn't worry about it because it's not certain. To be honest, how can you be certain whether an unborn child can feel pain? It's very, very difficult to actually know because you can't ask them. Okay, but they're erring on the side of, well, basically we don't care because no one can prove it. Okay, moving on. This is particularly sad, this section. Right, a note on disposal of fetal remains. Fetal remains, Translation into everyday English, dead babies. While not directly related to the law on abortion, the group consider that the Scottish Government should take this opportunity to reconsider current guidance around the disposal of pregnancy remains, euphemism, including an induced abortion or pregnancy loss up to 24 weeks gestation. Currently in Scotland, guidance limits the options of disposal available to women, with a requirement that pregnancy remains of any gestation collected by healthcare professionals are subject to cremation or burial. In other words, treated with the respect that you'd give to a person. This is despite the legal framework that a fetus is only part of the woman, not a distinct entity in its own right. Quite chilling, isn't it? Cremation is often associated with a ceremony and or religious or spiritual ritual and takes place with a registered crematorium under the oversight of a registrar. While this may be the most appropriate choice for some women in these circumstances, for some it may be viewed as insensitive because it makes the truth clear that we're dealing with a death here as a result of choices made. Burial can be similarly emotionally taxing for women, given the association with the loss of other family members or friends. It's interesting, isn't it, when people are writing about abortion and they're trying to use the euphemisms and avoid the obvious conclusions, but they can't do it. They slip up every now and again and reveal that they do actually think that the unborn child, is a person. And here's the slip up. Burial can be similarly emotionally taxing for women, given the association with the loss of other family members or friends. Why is the word other in there? It's other because they're assuming that the unborn child is a family member. And a burial would remind them of other family members or friends. So it's a slip-up that reveals what people really think. People really know that the unborn child is a person. Right, because of the requirement for disposal to be via one of these options, a full consent form has to be undertaken with the woman during the consultation process, which abortion providers report can be incredibly distressing, particularly at earlier gestations, where if a woman had opted for early medical abortion at home as opposed to surgical or in-hospital early medical abortion care, there would be no such requirements. Right, translation. If a woman takes the pills at home, she can flush the little baby down the toilet, or as we heard about a couple of years ago at the family party conference, if it happens out on a walk, you can dig a little hole and bury the little baby where you are going for a walk. And that's what they're saying. So they're saying it's not fair. How come the woman at home can flush the baby down the toilet, and the one in hospital has to fill a form in saying what happens to the remains? I mean, wow, let's carry on. Current guidance also requires that pregnancy remains are required to be stored in a mortuary, which in the light of other proposals in this paper around accessibility and the provision of care, could limit where an abortion can be provided in practice. In other words, so currently the dead baby would have to go to a mortuary, but they're saying, no, we don't want that because we want to be able to do abortions all over the place where there's no mortuary. The group consider that any legislation or guidance on this matter should reflect patient choice at its core and recognise the woman experiencing pregnancy loss of any kind may not feel that cremation or burial is appropriate. Cremation, burial, incineration, or the return of the pregnancy remains to the woman when requested are available options, and that women should also have the right to decline to discuss how their pregnancy remains are managed. They're really doing their best to smooth this over without getting to the core of the matter, as I say, which is basically babies being flushed down the toilet, and they just want to be able to dispose of them as clinical waste, basically. Anyway, moving on. A US study that examined the association between state abortion policy contexts and maternal death found the states with a higher number of abortion-restricting policies had a 7% increase in total maternal mortality compared with states with more liberal policies during the years 2015 to 2018. Right, this is the sort of thing that leads to the ridiculous placards we see sometimes, or chants Pro-life, that's a lie. You don't care if people die. So this statistic is intended to show if you have restrictive abortion laws, then more women die in childbirth. Okay? And then it goes on to say, since Roe versus Wade was overturned, concern has been expressed that restricting access to abortion in many US states will result in measurable increases in maternal mortality, particularly among poor women and women of colour. So they're saying they're worried that this might happen. That's what's in the report. But instead of just writing that they're worried it might happen, how about looking at the evidence of what's actually happened? Because the evidence is there. It's online. You can just go and look it up. So a study was published January 2024, found that in the 12 months ending January 2023 in America, the sum of maternal deaths had declined by 28.2% compared to a previous high point. And I think that was largely due to the deaths were higher during COVID because of failure to get appropriate care, etc. That is what resulted in a spike. Another survey research piece in America found no statistically significant rise in maternal mortality tied directly to the post-Dobbs law changes, Roe versus Wade being overturned, largely due to maternal death being a rare event and variation in reporting. So basically they're saying the statistics gathered in this, you can't draw any conclusions from them because maternal death is a very rare event and different states report it differently. Okay, that was 5 minutes of research from me on the internet. But in the report, they just quote this one study and this one concern that to say 5 minutes research by me will show that that's not right. It's not credible. The facts don't back it up. But it's there in the report. How many of the MSPs will do 5 minutes on the internet to check it? Virtually none. Virtually none. But that's the Scottish Parliament for you. Lack of critical thinking. Right, next section. Estimates of the number of abortions in the UK before 1967 ranged from around 10,000 to 250,000 a year. So this is before abortion was legalised. So they're estimating that the number of abortions could have been up to 250,000 a year. In other words, about the same as it is now. I mean, that's totally ridiculous. How could anyone even begin to believe that there were as many abortions before the Abortion Act as there are now? Because since the Abortion Act, the number of abortions a year has gone up and up and up and up and up and up. But they're saying actually the number of abortions that have taken place has actually remained pretty well exactly the same all through that. I mean, how could anyone commit that to print? Because it is so utterly unbelievable. But critical thinking doesn't seem to be the strong point. So let's come around there. So the group therefore considered a framework that is protective of women and supportive of the provision of safe abortion care. I mean, how about that? Safe, ridiculous. Abortion care, ridiculous. Anyway, rather than one designed to pursue what it believes to be an ultimately illusory goal of using criminal law to delay, deter, or limit the ability of women to access abortion care. In other words, restrictions on abortion don't work. So if you introduced the death penalty for having an abortion, it would make no difference. There'd still be just as many abortions. Does anyone apply this to any other area? There's no point making it a crime to drive over the speed limit. People do it in any case. It'll make no difference. There's no point making murder illegal. Just as many murders are going. I mean, it's just total nonsense. Of course, making something illegal, having punishments for it, making it more difficult to access, is going to result in fewer people doing it. It's just so obvious, but they deny that. So they're basically saying people who want to restrict the number of abortions by using the law, it just doesn't work. And they're saying that in the light of the suggestion that basically the number of abortions in Britain has been the same from the 1960s till now. It's just there used to be 250,000 illegal abortions and there's now 250,000 legal ones, but it's just the same number. I mean, I don't think anyone can genuinely claim that they really believe that. Right, so this is in the conclusion. Members of the expert group were all deeply honoured to have been asked to be part of this process, and all have been thoroughly engaged every step of the way. We are proud to have been given responsibility of making proposals for reform. We look forward to hearing the views of the Scottish Government. First of all, how sad is it to hear these people, honoured, proud, pillars of society, honoured by the government, paid by the government to play this fantastic role in making Scotland a better place. Morality is upside down, isn't it? We look forward to hearing the views of the Scottish Government. Spoiler alert, I'll tell you what they're going to say. They're going to say, thanks very much, we absolutely agree with you. And Labour will absolutely agree as well. The Lib Dems will absolutely agree. The Greens will be saying this is not far enough. Surely we can do better than this. And the Conservatives, they might nitpick about some of it. Reform might nitpick some of it. And I'll come back to that in a minute. Right, a bit about the morality. Could they mention morality in order to dismiss it at some points in the report? So it says, the group understands that abortion raises important moral questions upon which reasonable people have sincerely held, yet sometimes starkly opposed views. In recognising that abortion services should be treated first and foremost as a healthcare matter, does not deny these moral views. Yes, it does. Of course it does. I mean, I was saying, so I believe that abortion involves the taking of an innocent human life, which is a grave moral issue, and they say, no, it's just a medical procedure, just like having a tooth out. But that's not to disagree with you. That doesn't mean you're wrong. I mean, do they really think people are so stupid that they're going to go, oh, yeah, I see what you mean. Actually, the fact that I think this is a grave evil and they're saying, no, let's just go ahead and do it, that doesn't mean they disagree with me. That doesn't mean that what they're saying is incompatible with what I think. They respect my views. So I think, yeah, maybe I should respect their views as well. And then, that sounds quite reasonable, doesn't it? I mean, is anyone really going to be so stupid as to fall for that? I mean, to be honest, I think maybe some people do fall for that type of thinking. But not us, obviously. Right, so they say, does the potential model promote equal access to abortion as a means to improve healthcare outcomes for all, taking intersectionality into account? So the morality of the value of human life, dismissed. They're not interested in that. They reject that completely. But then we've got the Scottish government's, the establishment's morality. And that's about intersectionality. How does it apply to, men and women, or people of different races, or refugees, or rich people and poor people, or transgender people? That's their idea of morality. Then they say, does the potential model situate abortion appropriately within the wider structural gender equality aims? Again, this is their moral system. Value of human life, out the window. Equality and human rights, that's what it's based on. Human rights as defined by them. And as defined by the United Nations and the World Health Organization, who are quoted extensively through the report. Because the United Nations and the World Health Organization are basically pro-abortion extremists. So if you're a pro-abortion extremist as well, you can just quote them left, right and centre. And most MSPs will just think, oh, the United Nations say, oh, the World Health Organization say, oh, well, that must be what everyone thinks. I'll just go along with it. And they will. Right, so last little passage from the report. However, the review itself does not cover the complex moral and ethical questions relating to abortion, such as when human life begins or concepts of personhood. Well, when it says it doesn't cover them, what they mean is they're assuming one particular view before they even start. It's not that they're not included, it's they're taking for granted a particular view. But they're trying to say, well, it's not our remit. Okay, whose remit is it? Who in the government, which government department has the remit to decide these key moral questions? Well, the answer is none of them. It's no one's remit. The remit on this one is the electorate. We know what the values of the SNP are. We know this is what they think. And the decision was made by the electorate to elect them. So that's why we've got this. That's why we're where we are with these moral values. Right, 3 important points to make in response to this. First of all, lobbying will not work. Okay, anyone who says, oh, this is a crisis, let's get right into an MP, right into the MSPs, let's get a petition, let's go and meet with them, go and meet with your MSP, waste of time. It will not work. It is a total waste of time. This is going to pass. I mean, after the election next year, Labour or SNP will form the government, who knows, but whoever, this will pass. Okay, there might be a tweak here and there, but fundamentally it will pass. Now you may think, oh, look at assisted suicide. People have been changing their minds, they're a bit split down the middle. Assisted suicide is quite an unusual moral issue in that it's respectable to be on either side of it. And so people will say what they really think. With this issue, if you're pro-life, it's career ending, which is why, I mean, there's one pro-life MSP in the Scottish Parliament, John Mason, and he's standing down at the next election. So in the next Parliament, there could well be 0 pro-life MSPs. Now, if you think you're going to win them over by writing letters and emailing them, 129 pro-abortion MSPs, and you think you're going to influence them by lobbying and diplomacy and persuasion, forget it. It's a fool's errand to try and address this issue by interacting with the MSPs, with the current ones or with the ones after the election as well. This is how this is going to be decided, and that is at the election. There's an election next year, and that will determine who is in the Scottish Parliament when this is brought forward as a bill. Okay? So petitions, email or whatever, not going to work. This is going to be determined by how people vote on the 7th of May next year and which MSPs are in the Parliament. Simple as that. And the other thing I would emphasise, I mean, these issues in this, it is appalling. They're grave issues. They're grave issues and they're great evils. But let's remember the central issue in Scotland, 19,000 unborn children killed every year. That's the central issue. What difference would these reforms make? To be honest, it's tinkering at the margins. What difference would it make to the 19,000 figure? I mean, to be honest, it wouldn't make much difference. It would push it up by maybe 10 or 20 or 50 or something. Not really going to make a great deal of difference. And my fear is that, let's say the Conservatives say, oh, we oppose some of this. Let's say Reform say, oh, yeah, we oppose some of that. I really hope people don't think, oh, well, they're sort of on the pro-life side, aren't they? No, they're not. No, they're not. If Reform formed the Scottish Government, 19,000 unborn children a year in the womb would be killed. If the Conservatives formed the Scottish Government, 19,000 unborn children a year would be killed. If the Scottish Family Party formed the Scottish Government, somewhere in the region of 0 unborn children would be killed in the womb. So it's a simple issue on the pro-life matter. You either vote for abortion, 19,000 a year, and it's probably going to keep going up, or you vote against it. Simple as that. You either get behind a party that would stop that, or you get behind a party that would continue it. So, over to you.